I'm a dental hygiene student. Let's talk about embryology part 2. Okay, so now that we've basically made the neural tube start growing from our cranial to our caudal, which is our head, to our butt, our caudal. So our neural tube is made, and then eventually it closes, and then the buccopharyngeal membrane opens. Buccopharyngeal eventually becomes an oropharyngeal, because the oral and then the pharynx, all of these different pharyngeal arches are going to start growing. We also have the stomodeum. The way I remember it is stuff your face or stuff your mouth, because it's starting to develop an oral cavity. Cavities are basically going to be starting to make placodes, which are special sense organs. Our eyes, our ears, our mouth, our nose. That oro/buccopharyngeal, like, it starts and then eventually it stops and disintegrates and becomes the stomodeum and becomes that open oral cavity. This is also placode right here. It's your nasal placode, and then your optic placode, because it's your nose, and then your eyes on the side. And when we talk about it, eventually you're gonna have your ears, which are optic placodes. Okay, let's talk about pharyngeal arches. We have basically 6 of them, but the 5th one's like missing. Don't know why it's like that, but it is. So we have the first one. Know that the first regular arch is going to be innervated by cranial nerve number 5. Number 2 arch is going to be innervated by cranial nerve 7. Number 3 arch is going to be innervated by nerve 9. Arch 4 through 6 is going to be innervated by nerve 10. Cranial nerve number 5 is going to be the trigeminal nerve. The trigeminal nerve goes to our eyes, our maxillary, and our mandibular. It's basically also connects with our facial nerve, like arch number 2. That's connected to our facial nerve. That also helps with muscles of facial expression. This is arch number 3. Number 3 is going to be innervating with nerve number 9, the glossopharyngeal. We have this fun little chart here. So this number 9 here is going to be glossopharyngeal. It's going to be the posterior 1/3 of the tongue. We also have the anterior 2/3 of the tongue, which is going to be a mix of the trigeminal nerve and also the hypoglossal nerve, which helps with the motor function of the tongue. And in the very, very far back is going to be the vagus nerve, number 10. That's the root of the tongue. This is the root, this is the body. Okay, and then arches 4 through 6 is also going to be innervated by number 10, which is in that very posterior part of the tongue, the root, the base. Eventually, these are going to go up and make the tongue and the neck. Basically, 3 to 6 helps make the tongue. Like, it grows and eventually makes the tongue. Know that in the mandibular, the first arch is going to have a Meckel's cartilage, a malleus, an incus. It's going to help make the maxillary and the mandible, the cheekbones, the zygomas, and the temporalis. And then arch number 2 is going to be called your hyoid arch. This is a hyoid, basically, if you don't know. Those are also prone to getting cysts. I had one when I was younger, so that's why I know it the most, is that they're prone to getting cysts when there's things happening while the developmental process is happening. This has the right cartilage. It's not on here. I'm going to put it on the screen to spell it. It has the stapes. Think about like your ear, because it's going to grow external auditory meatus. It's also going to have a styloid process. It's going to attach to the lesser horns of the hyoid bone. It's also gonna help form the palatine tonsils as well. And remember, facial expressions, because it connects to cranial nerve number 7, which is the facial nerve. Number 3, like we just talked about, that also goes into the hyoid bone, but it gets the lesser horns of the hyoid bone. And eventually those obliterate and turn into the neck, like it smooths out the contour of the neck. 4 through 6 basically makes the thyroid and the cricoid. So here's your hyoid bone, and then you have your thyroid, and like right on top of it is the cricoid. The cricoid's basically just like cartilage. So the first arch is basically going to help with like the facial development, and then number 2 kind of does it as well, but majority of it just helps go and form the neck. Brachial grooves are going to be on the external side. This is going to be the eardrum, and also there's these things called clefts. That's going to be part of the eardrum. It's going to be on the outside, making that not eardrum. That's the tympanic cavity, which is actually on the inside of these pouches. The pouches are going to be the endodermal evagination from the lateral linings of the wall is just gonna like invaginates, it's gonna go inwards. So this first one goes and creates that eardrum, the tympanic cavity. The second pouch gives rise to the palatine tonsillar tonsil. And then these 3, 4, and 6, they give rise to the thymus and the thyroid areas. Next video, we're going to talk about how the face is formed.